my name is Katie Brumfield, and I am the Career Services Specialist at the Colorado School of Public Health. And today we're talking with one of our alums, William Mundo. He graduated in 2016 with his Master's in Public Health with a concentration in Health Systems Management and Policy with a global track. And William's going to talk to us today about what he's doing in his career. Thanks for joining us.
Yeah, thank you so much, Katie. I really appreciate being here and talking to potential students. Like I said, my name is William Mundo. I am a first-generation student that was born in California and raised here in Colorado. And currently, what I'm doing full-time is I'm still in school, but I am currently in medical school. I'm in my third year of my medical degree right now. And, a lot of the things that I've been doing as a medical student, have been kind of setting me up to what I'm going to be doing as a healthcare professional. But the cornerstone really of my medical practice is public health. And we're seeing a lot of that in the direction that we're moving towards. So I think it's really important for physicians to be trained in public health, considering a lot of the things that we're dealing with right now.
Yeah, absolutely. And I know it's been kind of a more of a trend to see doctors getting an MPH while they're in med school, which you got the MPH before med school, which I'm sure helped with your application process.
Yeah, absolutely. Yeah, there's a lot of different options to go about it. I think for me, it was a little bit different in the sense that, being a first generation student, I didn't really know what I needed to do to get into med school, let alone even to a master's prep program. But looking at it in retrospective, I definitely wouldn't change anything about it. But I think there are definitely other routes to get your master's in public health while in medical school or even afterwards. Yeah. Personally, I'm a little biased in the sense that, having a foundation in public health going into medical school really makes a big difference, because not only do you have a different perspective when you're trying to treat patients, but you can also serve as a resource and as a advocate for public health amongst your colleagues who aren't really aware of it.
Yeah, I think that's amazing. That's so great. How do you feel like the Colorado School of Public Health helped you prepare for med school?
I mean, I think really, and the first thing is I think it really helped launch my research career. And I think that's kind of one of the things that the medical schools really liked is that I had a really a public health equity research focus. And I think that's really what helped me out. I think also being a graduate student and kind of getting a feel of a graduate campus really helped that transition a lot more smoother for sure.
Yeah, because you're at CU Anschutz Med School.
Yeah, that's right.
So you've spent a long time on our campus.
Yeah, I've been there for quite some time, and honestly, it's been really great being able to connect and network with a lot of the people on campus. And as a result of being there, I've had the privilege to not only be around, but serve as a representative and as a leader on campus. And I really think getting my master's at public health at the Colorado School of Public Health set me up for that.
Yeah, that's awesome. What advice would you have for someone that was interested in a public health degree and interested in med school?
Yeah, I would say it's really great in the sense that I think you should do it first of all. And I think it's really great in the sense that it prepares you in multiple different aspects. So a lot of people think about if I get a degree in public health and then going into medical school, I'm not going to be using my public health degree. But in reality, that's not true. As a result of the public health degree, I've been able to start my own company, my own consulting company. And I've done some work with the World Health Organization. I have a contract with them. I have a contract with the Accords, which is a research, big research hub here at the Anschutz Medical Campus. I have another contract in Guatemala trying to implement their hypertension control program. So it really has opened a lot of doors. And on top of that has really kind of left my mark in the sense of a lot of the research that I've been doing. And so it's been really helpful to not only use my public health degree in the medical practice, but to also expand my my entrepreneur workshop and also other opportunities that present themselves.
Wow. And I saw on LinkedIn you're writing a book.
Oh yeah, and then yeah, so that's another project that I've kind of been working on, and it's really great because I think the public health degree has really given me the confidence and the knowledge to write this book, and a lot of the book is going to be focused on like public health in my life, and just kind of the importance of it, and so I think it's been a really great a journey so far, and I think getting the master's in public health really was the foundation to a lot of these things that I'm doing right now.
How do you find time to do all of this?
Yeah, well, I think the thing is that I think there is time. Time is limited, but there is time, and you'll make time for the things that you love to do. And for me, a lot of these things are just things that I'm passionate about. So it's really, whenever it's funny because whenever I'm gonna go to the hospital or to the clinic, I'm just like, oh, I'm so ready to go back, or like when I'm writing this book or and engaging with these different organizations around the world. It's just something that I'm super passionate about. So it helps that, everything that I'm doing aligns with what I'm passionate about.
Yeah. You mentioned your consulting company that you have. What types of projects are you working on, or can you tell us kind of
Yeah,
a broad
absolutely.
overview?
Yeah, so I like you said, I did my master's in public health and health systems management and policy with the emphasis in global health. And after I got my MPH, I started my own consulting business, and as such, I manage all the aspects of its operation. And a lot of the expertise that I help around to these organizations is really focused on health systems and research. And so one of the projects that I'm working on with the World Health Organization actually is we're currently developing this CU Global Emergency Care Initiative. And so we're really trying to, provide emergency care knowledge to a lot of rural areas around the world. But my specific focus is in Latin America. And so what I'm helping is transform the curriculum so it could be culturally sensitive, but also linguistically congruent with these communities, but then also infusing really that public health background amongst all of it. And so that's a project that I've been working on, and I think we're going to be done with it here pretty soon. And so it'll be great to kind of see that work, roll out across all of Latin America. So it should be awesome.
Yeah.
Yeah.
Wow. Gosh, that's amazing. I know, students a lot of times after they graduate with their MPH, they don't think that they can go into consulting because they feel like they need a lot more experience. Could you touch on that?
Yeah, I think for me, it was really, I asked myself, what is something that I know a lot about. And I think if you get a master's in public health, that says a lot that you know a lot about public health. So I think it's really, it takes a lot of confidence, but at the same time, you have to be able to put yourself out there and take these opportunities, even though you don't know much about it. Like for me, I didn't know much about consulting, and I was like, I'm just gonna do it. I have my area of expertise, and it really, I kind of just jumped out, and I hit the ground running, and it's been working great ever since. So I would say, definitely if you have a master's in public health, and even if you don't have any experience in consulting, I think it's still doable, just because consulting is so it's so versatile, right? In the sense that your knowledge is kind of what you're selling, and I think that's something that nobody really taught me much about, and I think even though nobody taught me much about, it just seems so natural because that's just what you spend a lot of your time studying.
Yeah. Wow. Cool. So where do you see your career going in the next 3 to 5 years?
Yeah, so in the next 3 to 5 years, so I'll be graduating from medical school next year. And so hopefully by the next 3 to 5 years, I'll be finishing up residency, and I'll be kind of, working here in Colorado for sure. I think what I really want to focus on is, establishing my own practice where I am able to provide medical care to people, but at the same time, have a space for public health initiatives and public health research and public health services. And so I hope to kind of start doing that, whether it's integrating it with, the university or with Denver Health, is something that I'm really focused on. And then I'm also interested in applying to the National Health Service Corps, and kind of using that as an opportunity to serve the communities that I've that I want to serve and that I'm doing this for. And hopefully that will kind of set me up for, in the future, maybe going into some like state, federal level health advising, whether it be like, the Surgeon General or just kind of like, a policy analyst for CDPHE or something like that. And also having the flexibility to serve my patients is really what I'm hoping to do. So yeah, public health is definitely not going to go anywhere for me. It's something that I'm going to continue to integrate in every aspect of my career.
That's great. Wow. I'm really excited to see where your career goes. So I'll be following you on LinkedIn.
Thank you. Appreciate it.
Well, thanks for joining us today, and thanks for sharing your experience. And thank you for all the amazing work you're doing in public health and the medical field. Thanks.
Yeah, thank you for having me. And yeah, I hopefully, some people, this changes some people's mind and decide to pursue a degree in public health. And if you come to the School of Public Health, I'm sure you'll probably run into me at some point.